Ayubowan. Welcome to Dhamma Hadaya, the Dhamma discussion in English. Look at this dressed up body, all sores, supported by bones, sickly and subject of many, many thoughts. Indeed, that body is neither permanent nor enduring. I quoted this from Dhammapada. Well, I thought of making this small quotation from Dhammapada because we thought of bringing up this very special topic in today's Dhamma discussion, a topic which applies to everybody under the sun, but a topic almost most of us fear to talk about and most of us don't like to discuss about. So before I introduce this topic to you, let me introduce the resource person today. Of course, you are familiar with her, and for those fans who are with us for the first time, I'll introduce her. She is none other than Dr. Shiroma Bandara, a Sri Lankan living in UK. And she used to be a dentist. Now I would call her a meditation teacher. So with her, we are going to have this discussion today about, and it has definitely something to do with the Dhammapada stanza that I quoted. So the topic we shall be discussing today is death, disease and disability. Well, this is a topic I'm sure that all of us have to face in life, whether we like it or not. But yet, we fear to talk about it. So we thought, let us bring up this topic because it's going to be important. There might even be someone, who is scared to face these situations. And maybe there's a loved one at your home, and maybe you are under a lot of stress because of that loved one who is suffering from a particular disease or probably on his or her deathbed. So while warmly welcoming Dr. Shiroma Bandara to our program today, to Dhamma Hadaya, first of all, ma'am, as I quoted from this Dhammapada, and I said people are reluctant to talk about this topic, death, disease and disability.
Yes.
So that is mainly because of the fear.
Yes, mainly because of fear of death and disease, and also not knowing too much about it, I would say, because they don't want to approach the subject because it's a very sensitive subject, and
Yes.
And not knowing what to say, how to act, how to react in front of people who are suffering from especially terminal diseases. It's very it's a bizarre situation. I do get a lot of letters from the viewers, and it's surprisingly a lot of letters where they have to cope with terminal diseases, and or they are looking after someone suffering from, let's say, cancers and terminal cancers. And their main question is that they are practicing Buddhists and they are meditators and they do a lot of daily meditations, but when they hear about someone close to them being diagnosed of a terminal disease or some severe affliction or an illness, how their mind goes into pieces and they just can't cope with it. And they wonder why am I panicking and I'm so fearful and all this turmoil and within me. And it's the same with the person who suffers with the disease. Let's say at a doctor, and he very kindly, very compassionately tells you that you have got this condition and you have this cancer in your body. At once the mind goes to shock and then denial, and they just don't know how to cope with it. And then weeks pass where you think this is just a dream and it will just pass away and it is not happening to me. And it takes a lot of time for them to accept and come to terms with it, and then to deal with it and cope with it. So I was wondering that in Buddha's teachings, it's more like therapy to your mind and body. And Buddha comes across, and I remember a place where in the iti kata vastu, there was a phrase that I once read. An Arhat or the Buddha, the Blessed One, would say, I'm a Brahmin and I come to serve you and respond to all your requests and open-mindedly to heal your body and mind. I'm a doctor, an unsurpassed surgeon, and you are my children of the Dhamma, and I have given birth to you from my mouth, meaning with the teachings of the Dhamma, and you are heirs to the Dhamma and not heirs to material comforts, something to that effect. So he comes across as the doctor, the healer for your body and mind. And being in that Dhamma and practicing the Dhamma, why does it happen to your mind? That is the question. Why can't we cope? Why do we still, the mind doesn't accept it? So it's a good question. It's a good area to think about why.
Yes, and I guess most of us don't realize it unless we face that situation ourselves.
Absolutely.
Then
yes.
only we go through what sort of feeling the person on his or her deathbed or the person who is suffering from a terminal disease gets.
Yes.
Well, ma'am, having talked about that, how do you think a person can cope up with his death moment?
Yes.
How can he handle it?
This is, if you think about the reason why we can't accept disease, why does it shock us and puts us into such a turmoil? I was thinking that it's because our mind always looks outside to the world and thinks our body, everyone else's body, our loved ones, and everything else in the world is permanent. And it's a pleasurable thing and it's a pleasant thing, and they're all mine and I can control and I'm in charge. So this sukha, subha sukha, nitya, atta, sanya perception that we have with the looking at the whole world. And this actually is proof that unless you do the actual real Dhamma practice, this perception doesn't break that easily. And as you very rightly said, until it happens to you, you don't know how you cope and how you react. And I find a lot of people in our Dhamma groups who come and say, oh, I have given up my body, I don't care about my body, it has diseases and it's subject to illness and death, I know all about that and I don't care. And there are a couple of families who are undergoing a stressful period at the moment with their loved ones having been diagnosed with a terminal cancer, and the reaction now is such a total different reaction. So I would think how they were talking so many months ago and before and now, what is this reaction all about? So it's a really good area and a subject to address, and then we have to think, how do we crack this illusion that things are permanent, our body, everybody's body is pleasant, pleasurable, beautiful, and it can be controlled by us and belongs to us. That has to be cracked with certain meditations. And I can talk about this disease very personally because 3 years ago my mother, she was a very lovely lady, very active when she was 81, but very active, looked after herself very well, very strong, very healthy, and suddenly she had a stomach ache and she was diagnosed with a pancreatic cancer, terminal stages. So it gave her a lot of shock at the beginning, and it shocked everybody around, even though our whole family is into Dhamma. Various different people, my brother, sister, the cousins, relatives, reacted in different ways. But I must say I have a huge respect that they didn't go down too much. There was Dhamma supporting them, but there were a lot of tears and anguish and stress. And I nursed her for 3 months. I came here and nursed her, and I like to share what actually helped me go through with it. And this is I didn't ever think that these meditations would help in this way. And this is all the Satipatthana meditations. Leave alone all the Sila. You could practice your Sila to 100%, but I don't think that would have helped me, or even my Samadhi mind would have helped me to such an extent, but the practice of Satipatthana. And in that, particularly the Dhatu Manasikara meditation about the 4 elements of the body, that we have been practicing a lot, and the Asubha Bhavana. But most importantly, what helped me was the Navasivata Bhavana. So this meditation is about the dead body and the 9 stages the dead body goes through. And we actually just put it aside, or we don't give much emphasis to it, and we jump over it and give all
it's rather disgusting to most of us.
Yes, and gives all the prominence to the Anapanasati meditation, so on and so forth. But my teacher at that time asked me to practice this Navasivati meditation, and we started with unknown person's body and how it goes through the 9 stages of getting blue and cold and getting hard and rots and it splits and all the pus oozes out, and the smell and disgusting stages, and all the changes of the 4 elements within that, and how the crows and the dogs and the foxes get at it, the worms and flies, and at the end the bones get scattered and broken and turned to dust and gets one with the universe. This we have been doing like millions of times with unknown body at first, and with your body placed in front. So you imagine yourself dead right now, dead, and everyone out there looking at you. You visualize your funeral, and so you go through the stages. That's not hard enough. Then I was asked to do this meditation placing my mother in front, which was, you have to imagine your mother dead, and all these 9 stages happening to her body, which was rather difficult, but I
think
got
it's
over it.
Rather difficult than the first one, than placing yourself.
Yes, much more difficult. But most difficult was when I was asked to put my 2 children in front and imagine them dead and their body. That I just couldn't do. So I had to go back to him and say, can't do it. Why can't you do it? I said, because of these negative thoughts, they will get ill. Then he said, place me in front of you and do the Navasivata meditation and come and tell me next week, which I did. So I could do I didn't want anything to happen to him, my Dhamma teacher, but eventually I did. And then the following week he asked me, look at me, nothing has happened to me. I haven't got a pimple or a rash or any blister or anything. So nothing happens, and the Buddha will never ask us to do it. If that is the case, if there was a negative reaction, and with Shraddha, with Buddha's teachings, go back and do it. So I had done this meditation on my mother so many times, and when right in front of my eyes, my mother's body, she was a beautiful lady, and her legs started to get swollen, and her arms and the body started to swell up at the later stages, and
she was still alive, but
she was
on her
alive. She was walking, then she couldn't walk. Then you must relate, if you knew someone who was suffering with cancer, what happens, the stages, then they get bedridden, and then they can move, but then their legs go first, and they can't move the legs. Their legs become lifeless and swollen, and the body, then the arms and all that gets swollen. Then she was hospitalized, and every day in the morning when I used to go and talk to her and joke with her, she used to smile and say a few things and have for the jokes and communicate with me. And the next day when I went, she couldn't talk, so she would smile and look at me, and her eyes were smiling, and then we communicated. The next day when I went, she couldn't smile, all the facial muscles had gone dead, and she was smiling with her eyes, and next day when I went, that shook me a little. Her eyes all was frozen. I was as if I was looking at a doll, and I was still joking and laughing, and there was nothing. It was like talking to a doll, but I knew the words. She probably was, I don't know, was listening to me, but there was nothing. And then my mind, I looked inside my mind. I was observing this, and there was so much sympathy and sadness, but it didn't go into pieces. It was calm. Behind the sadness, it was very calm. And then I looked at my mind and said, I have seen this before. In my mind, the mind had seen this in the meditation, all the stages.
I'm sure it would have definitely helped.
The mind didn't panic. The mind was not shocked because it
was
knew.
Prepared.
It was prepared because it had seen it before.
It has rehearsed and practiced.
Yes, and it was
moment.
very calm. Others in my family actually couldn't take it and went in different directions. And I thought this is so powerful, and my Shraddha for Buddha Dhamma Sangha, the Dhamma actually went sky high. So this I can tell with experience. Out of the Satipatthana meditations, the Kaya-nupassana meditations would help immensely to face diseases and even death, and to see a loved one going through this process, or even your body going through this process, because your mind has seen it, has seen the changes. So it's a meditation that I would stress that we can do.
So it's not by surprise. You were really prepared for
yes.
it.
So because of the calmness, I could feed her, I could look after her, I could go near her. My voice was very calm and tender and loving, and I wasn't weeping and crying emotionally in front of her. So the main idea is to keep her mind calm, because she was very soon, she has to face death. So it would be very selfish to upset that mind. So that is what I would also bring the attention of the people around nursing a person with a terminal illness, and who is with the person who is dying, to keep you out of the equation and just purely concentrate on the mind state of the person who is undergoing this phenomena of death.
Definitely.
See, yes. So that was profound way of dealing with diseases.
Well, I'm extremely thankful to you, ma'am, for sharing with it, because I'm so sure among our viewers there would be people who have experienced the same thing. What I mean is like someone on the deathbed, and a loved one dead, and someone who is about to experience this. So I think this will be definitely helpful for them. And ma'am, since we talked about that stage, the dying moment, shall we also talk about the last thought moment, the Chuti Chitta, Chuti Chitta that we, that is very popular.
It's popular topic to discuss because it's so crucial for the person who is passing away. And it's like, I feel it's our duty to make that, because that person is so helpless lying there, so very helpless. Even her or his sixth senses are not there, have abandoned. So there is this last awareness there in a state of passing, and we have that responsibility to make it the best way for that person to pass. So I remember with my mom, when she was talking to me, we used to watch this Buddhist channel a lot and talk about Dhamma a lot, and I used to guide her a little meditations, and the main thing I told her was to, when your mind is weak, just be with your breath. And even that meditation, don't go to do too deep things of looking at the five aggregates through the breath, or complicated things. Just a very simple breath meditation, like you breathe in and gap, breathe out and let go, breathe in, let go, breathe out, let go, breathe in, let go, breathe out, let go. And when you let go your mind and body. Totally let go. Breathe in, totally let go. just to nothing, to emptiness. So when you practice that, keep practicing that all the time, because she was practicing it with me. And once when she had to go for an operation, she said, I wasn't scared, because when I was anesthetized, I went to the breath and did as you said. So I knew at her last dying moments, she would have done it, because even if our whole other senses are gone, there is a weak awareness there, and your breathing is spontaneously going anyway.
As long as you live.
Yeah, so you can just shift your awareness to the breath, calmly breathe in, breathe out, and if you have practiced this before, very easily it will come. And I have heard some venerable monks, meditating monks, saying if you actually do that and let go totally and die, with that letting go, you definitely get a next birth in a higher state, or even go from one Magga-pala to another Magga-pala, because the body and mind totally would be let go. So that's a profound way of going.
Definitely.
And your thought moment will be in the present moment, and your thoughts won't shift to other people, and there won't be lobha moha dvesha at that time. It will be a pure, beautiful thought moment to die with, the last moment. So even though we say that the huge garuka kamma can come, the asanna chitta kamma, achinna chitta, all these chittas can come there, but I strongly feel that if you have a trained mind, and there is a training of the mind, that will bypass all the other factors, and that will come forth, your training of the mind, and save you. So you don't have to fear death, because you know how to die, and you know it's going to be a peaceful process. And also you can look at the death moment like a blessing, because it's a beautiful moment for you to achieve a higher state of even Magga-pala, if you practice it. And because your body is gone and your mind, you will let go. So here you are, and you take advantage of your last dying moment and look forward to it. Practice it and
Yes,
look
I'm
forward
sure.
to it.
Maybe from the viewers who are watching our program, maybe they're hearing this for the first time, that death moment is nothing but a beautiful moment to pass on to a better stage of mind. So thank you very much, ma'am, because we see it in a very positive aspect now. And since we talked about a person who's dying, and we actually talked about, you actually taught how to die and how to die effectively.
I don't know whether it will work. I haven't died yet, but I'm sure with this teaching
that's
it will work.
That's very helpful. But what about the people around the dying person? Sometimes the person who's dying will be happy. The person who's dying will go to a better stage.
Yes.
But the people around, they can't, cope up with it. What is your advice?
Yes, as I said before, don't put yourself in front or into that equation at all. Just keep focus on the person who is dying. And I think this bit differs to different people. They should know the person who is dying. For instance, with my mother, because I know she was a meditator and she had done all the vipassana meditations, and what she valued, what kind of mind state she valued. When she was dying, we gave her complete silence. We didn't play pirit tapes, we didn't discuss Dhamma, we didn't want to talk to her, we didn't do any of that. But when we knew she was going with the last breath, and I was hoping she'll be with her own breath and let go of the breath itself. Apart from that, we didn't interfere with that stage. We just gave her perfect pure silence, and that I can say because we knew her. So you need to know the person. That
cannot be applied with everyone.
Yeah, maybe someone who knows Spirit, the Lord loves to hear the Pirit Buddha's teachings, that would help. But then again, my fear was, supposing they are struggling with something within, these words will not come very clear, and it might become a nuisance to them. We don't know. It may arouse some irritability and dislike. We don't know. So at that, even though they like Pirit, this time they might not want to listen to that period, but we really don't know what
and we don't know whether they're listening or not.
Yeah, whether the words will come, they are coherent, whether the words will be coherent to them, whether they could, their mind state would, whether it will come like a jumble and a big irritable noise. We don't know. So I didn't want to take that chance. So you need to go with how that person is, with Dhamma in mind, and maybe with beautiful pure silence. It's beautiful pure silence, and just talk with them and encourage them and guide their minds to that stage, and then let them pass away freely. With pure silence is my choice, and that I would like.
Yeah, because most of this time we see not everyone is strong enough to cope up with the loved one's death. Most of the time we hear about and we see, people hugging their loved ones.
Yes. I learned this because when my father died, and my mom told me this, that's how I know what she wanted. I knew. So she said, when she was near and in the bed, his hand was falling out of the bed, and she wanted to touch and lift it and put it, and she didn't. She said, if I touched him, it would arouse so many things in his mind. If the mind is calm and he's in a calmness there, he was a meditator too. So she let that, and she just watched. So that gave me an inkling how she would have wanted her last moments to be. And that's where you observe your loved ones and know what they would like, and talk to them and educate their mind to the Dhamma, and then you will understand, intuitively you will understand how they'd like to pass, and not put you in the forefront. That's the main thing.
Yeah, now from the topic of death, if we move on to disease, if maybe ourselves or someone we love, if someone is suffering from a terminal disease like cancer, for example, how can one cope with that?
Yes, if the way, as I said, is to see if you have done these Kaya-nupassana meditations and Vedana-nupassana mainly, you can look at the body, you will know that this is going to happen to that person, so your mind won't go to shock. And also Vedana-nupassana, where when sadness comes, you don't run around crying, weeping and calling people. You would just look inside. Take 5 seconds and go within and just look inside. Sadness has come. Why? Sadness. Just watching, you'll see that it is dissipating and it will go. And then when you've got a relatively calm mind, you can think, why am I sad? What is the reason? Do a bit of yoniso manasikara. And usually it is the wanting for that person to not be unwell, wanting that person to be healthy, and then analyze that wanting, how unreasonable that is, and that is not the way things are, and just say, let go of that wanting, and you do a little what we call a Chaturarya Satya Bhavana, Four Noble Truths Bhavana within you, within that 5 minutes, and practice that so you are calm and you're controlled, and you are able to help the person with the illness. It's the same I see with disabilities. When you have disabilities, also disabled people with 2 categories, like physically disabled and mentally disabled people. I find that physically disabled people, their disability shows if you're blind or deaf or physically disabled, and you have a kind of a little advantage there, not so much an advantage, but an understanding, society understanding. But people who have mental disability, they have that negative point where no one understands because no one can see their disability. And physically disabled people, 2 things they face. The first thing is that their helplessness. helplessness of not being able to cope with day-to-day things. But I find there is a deeper problem that they suffer more than the practical helplessness of coping with practical issues is coping with society. Coping with society in the sense they go out and suddenly, let's say there is a disabled person who comes to a whole stairway, and if that person can't climb with 2 legs, they will be able to climb with the 2 hands and the 2 legs, right? But the person will come there and will know I can climb this with my 2 legs and my hands, but would look around and they won't do it, and that makes them even doubly disabled. And the people around won't understand that. They will be looking and looking. I am a disabled person because I had polio at 2 years old, so I can again talk very personally. And the society has to be so compassionate. They are compassionate, especially Sri Lankans here are so compassionate, such kind hearts they have. When they see a disabled person, they want to look to see, oh, what happened to her, what happened to you, oh, how can I help? They look because of compassion.
Yeah, actually they want to help.
They care and they don't know what happened to her, oh, what happened to you. And all that is out of compassion, but it's such a hindrance to the person who is disabled, because that creates a self-consciousness in them. I'm different. The society makes them feel they are different. And actually, as I'm stating a fact, I could say living in UK, living in England, because I have a limp with my disability, I had polio, and it's I don't even remember I have a disability living there. No one looks at you. You go around, you do your stuff, and you're comfortable. You made your practical disability, dealt with it with your surgical shoe, so you can walk. So you walk around or you carry your walking stick and you are happily going around doing stuff, and no one is looking at you, no one is bothered that you are disabled, no one, not because they are unkind, because somehow or other they have that sense, if I look, that makes that person uncomfortable. So this is a message I like to send to the whole of Sri Lanka with compassionate heart. I know everyone is very compassionate, but it's a way our culture is. So to be a bit more sensitive, and your kindness would be to allow them to be whatever way they are. Because at the end of the day, what is normal? Who is normal? Everyone has some. More prettiest girl would say, oh, I've got a little fat in my tummy, or my hands are fat, or my nose is not. In their mind, they're so disabled about the body. So no one is happy with their body or with their mind. So I can't say there is a person normal, unless of course you are an arahat.
I guess everyone is suffering from some sort of mental disability, because sabbe satta ummattika.
Yes, everyone is bad.
Buddha.
Yeah. So here we are, the practical issues. Everyone can get over it, and the governments look after them, the hospitals, the charities look after them, and there are various different medical equipment for them for blindness, hard of hearing, and especially physical disabilities. Even if both your legs are cut off, you can walk now. So that's not the problem. Even your home you can change to suit you. You can have a lift to take you up the stairs, a little lift chair. So those are not the major things. So a disabled person becomes abled in that sense, but still disabled because of society. And it makes you, unless you are practicing yogi, where you see the illusion of a perception and anicca of the perception and see through that, where a practicing yogi will be able to do, the others will suffer a lot. So that is a point that we should think about when we see disabled people, physically disabled people around.
I think yes, that is something extremely they're sensitive about. Of
Yes.
course, people like to help, and people ask with the intention of helping them.
Yes,
Or can I carry
kindness.
your bag or whatever
Yes.
it is. So it's time that we should think more before we ask someone
Yes.
whether we should make them aware of their disability.
Yes.
So
Helping is fine, I'm not
Yes.
saying, but the staring and looking, even now if I cross the road, I could see everyone behind me and everyone in front. Because of my Dhamma, it becomes very funny to me. I observe it like just a phenomena, and I can relate to everyone. I can relate to people in the road more than people as much as in people in my family. So I can just become people in the roads can become family to me very quickly. So it doesn't bother me, but I can see how it can affect if you're not strong-minded. It has
Definitely.
affected me before when I was a teenager and growing up, and those years where it's hard for anyone to go through the adolescence age. So that is a thing we can remember and be very
now you have
sensitive.
overcome that.
Yes,
stage.
yes, and hugely because of my meditations, and also because I remember a little story.
Please.
When I went to the park with my father, he took me and my two sister and brother to the park, and we were all playing, and I was a very active, naughty child. I didn't care about the caliper. I would run and jump and do all kinds of things with the others. And suddenly I noticed that everyone was looking at me in the park. They came to look at the flowers, and now they've forgotten the flowers. They were looking at me. So I ran to my father and I said to him, and I was like 5 and he was tall. I looked up and I said, everyone is looking at me, everyone is looking at me, because I didn't know. I was just saying everyone is looking at me. And he knelt down and he said, you know what, everyone is looking at your face because it's the most beautiful face in whole of Sri Lanka.
Sweet.
He said, and then that would come to me so often in my life when people were looking, you're looking at the most beautiful face in Sri Lanka. And so afterwards, he injected so much Dhamma into me. And he equipped me with my shoes and everything, as well as equipped me with a very strong mind to face the challenges coming in front. And it worked. So
Definitely. And ma'am, I thought of going back to our topic, we talked about disease.
Yeah.
Now a question just rung in my mind. Now there are some people suffering from terminal illnesses who meditate to get, overcome that disease.
yes, yeah,
Or to fight that disease.
yes.
Is it possible?
Yes, it can be
Not
possible.
to let go, but to fight
Fight
and
it.
win.
Yes.
Be healthy.
There is another way of like metta meditation is a very powerful meditation, and you can direct metta as a force and energy and light, like a laser light, and spread it all through your body. And they in hospitals in London, they use that technique for healing purposes, mind over matter, and dissipate that cancerous cells and unwanted cells, and do that and metta to yourself. And that is one way of doing it, and there's nothing wrong with that. As long as you know the reality of that disease is a universal truth, and it is a universal suffering. And if you actually think of your Dhamma about your karma and karma-pala, first main thing, karmic forces come to is unfolding, and accept it. Okay, my karma has come now, it's unfolding, let it all pass. let it pass, and I will get over this, all of this karma in this birth, so that I won't carry it into a future birth. So accepting the karma, and also going into seeing the passing nature of phenomena, that the suffering is passing, the illness is passing, and it's rising and passing, the passing phenomena of the illness. So those two you can think the patient can contemplate on metta. And also for depression and all that, you can balance it with the samadhi meditations. When you do jhanas, your mind gets elevated to priti sukha. So whenever the mind falls with depression and huge panic attacks, you can practice a simple samatha samadhi meditation and increase. In fact, Buddha, as we had said that he is a surgeon and doctor, and his teachings come to my mind.
I was about to ask about the Buddha's teachings about these, especially about what we discussed today, death, disability and diseases.
Yes, because he calls himself the doctor and the surgeon. And looking at his Dhamma, I find, let's say he accepted there is a disease. He saw that there was a disease, and then he looked to diagnose it. So the diagnosis I see, like here is the suffering of illness, old age and death. And what is the cause of that disease and death? What was the cause? The birth was the cause. Right?
Yeah.
And because we were born, that happened. So what was the cause of the birth then? Was because we created an existence, the bhava. And what was the cause of that, creating that existence? It's a huge clinging and grasping of all past births and even this birth in the past. And this, what is the cause of this upadana, clinging and grasping? Is this tanha, liking, tanha, passion and desire. And so that is the cause. He found it, diagnosed it. And then, now what is the treatment plan? Said, okay, so to